This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Catherine says, I'm 28, have a low AMH, 4 PMOL/L, and was advised to do embryo banking prior to trying to conceive naturally. We've done 2 rounds, only 2 eggs collected in each round. The first round, normal IVF, both fertilized abnormally. One was 3PN, and the second round we did ICSI, and neither egg fertilized. Does this indicate that all of my eggs are poor quality, and we will struggle to conceive naturally, even though I'm only 28? No male factor issues.
Yeah, I suppose my first question, that's very unusual for a 28-year-old to have poor embryo quality. I would certainly be looking more at the stimulation regime, seeing whether we've got that, to then look at the embryology to see actually what they can see. What we do in my laboratory, and it's something I've been working in the research area for the last 15 years, is using polarized light microscopy to look at your eggs to see what the quality is like. And based upon what we can see inside the egg, which you can't normally see with light microscopy, some of the structures give us an indication of the genetic makeup of the egg, which is the main reason why eggs go wrong. I suppose I'd also be asking the question about the sperm. While he may have a normal sperm count, is there something called DNA fragmentation? I'd certainly be looking at that as a possibility. So there are some further things to investigate before I'd be saying this is a bad sign. The low AMH is unusual in a 28-year-old, but it certainly can happen. But again, I'd probably be investigating further as to why that might be. Yeah, a number of questions. I'm sorry I can't give the exact answers, but I'd be more than happy to talk to you in more detail through a consultation with my rooms, if you want to make an appointment. It's new, it's obviously, not surprisingly, it's a big worry. I would suggest to you your normal rates of conception are still probably going to be very good, but we need to look a bit more.